Action.
This is our video for L-spine assessment. So to start the L-spine assessment, we're going to do our palpations. So I'm going to ask my client to lie down on their back. I'm just going to palpate around your hips. Is that okay?
Mm-hmm.
Okay. So we're just going to palpate along the iliac crest, PSIS, ASIS, just to make sure everything is level. Do you have any pain or anything there?
No.
Okay. Tone is the same on both sides. Same temperature on both sides. Not overly a lot of tension. Okay, we're just going to move down to the knees. Do you have any pain there?
No.
Okay, and I'm going to get you to do a glute bridge for me, and then just drop your hips to the table. Okay, we're just going to see if the malleoli line up and check for leg length discrepancies. Okay, and the client's left leg is slightly longer than the other one, so we'll keep that in mind throughout our testing. Everything else seems to be okay. So now we're going to do palpation on the posterior side, and we're going to check the PSIS and along the spinous process of the lumbar spine. Do you have any pain?
No.
Okay. PSIS line up. Temperature's the same, relative same tonicity on both sides. Any pain?
No.
Okay. So now we're going to move on to rule outs for the lumbar spine. So we're going to be ruling out the hip, and we're going to be ruling out the thoracic spine. So I'm going to start with the hip. So I'll have my client turn over onto their back. And I'm just going to ask you to bring your knee to your chest. Do you have any pain there?
No.
Okay, it's going to apply some slight overpressure. Any pain?
No.
Okay, and then come back, and I'm going to have you turn your knee in and your foot out into medial rotation. Do you have any pain?
No.
I'm just going to apply a little bit of overpressure there. Any pain?
No.
Okay. So it's a rule out for the hip. Now we're going to do a rule out for the thoracic spine. So I'm going to ask my client to sit in the chair for me. Okay, and just push your lumbar spine or your lower back against the chair as much as you can so it's supported.
Okay.
Okay, and then I'm going to have you lean down with just your thoracic spine, keeping that low back on the chair. Do you have any pain?
Nope.
And apply a little bit of overpressure. Pain?
Nope.
Okay, and then I'm going to have you extend as much as you can into the chair. Do you have any pain?
Nope.
Okay, now we're going to have you bend to your right side, keeping that back on the chair. Do you have any pain?
Nope.
Okay, I'm just going to apply a little bit of overpressure.
Mm-hmm.
Pain?
Nope.
Okay, and then do the same on the other side, keeping your low back on the chair. Do you have any pain?
Nope.
Okay, just going to apply a little bit of overpressure there. Pain?
Nope.
Okay. So that's our rule outs for the thoracic spine and the hip. There's nothing going on there, so we can continue with our assessment of the L spine. So I'm going to have my client come back and have a seat on the table. Or no, I'll have you stand up for me. So I'm going to have you do flexion in your lumbar spine. So just reach down and touch your toes. And you have about, I'd say about 60, 70 degrees of lumbar flexion. That's normal. I'm just going to apply a little bit of overpressure to get our passive range. Any pain?
No.
Okay, and that would be a tissue stretch. So I'm going to ask you to come up, and I'm going to ask you to just stabilize at your hips, and then extend your spine as much as you can. Okay, do you have any pain there?
No.
Okay, so that's about 30 degrees of extension. That would be normal, and that would be a tissue stretch and feel. So now I'm going to have you do a lateral side bend. So I'm going to have you stand and put your left hand on your thigh, and then just reach down towards your knee. Do you have any pain?
No.
Okay, I'm just going to apply a little bit of overpressure for a passive. Any pain?
No.
Okay, so that would be a tissue stretch and feel. I'm going to ask you to do the same on the right side. Okay, do you have any pain?
Nope.
Okay, I'm just going to apply a little bit of overpressure for end feel.
Mm-hmm.
Any pain?
Nope.
Okay, that's a tissue stretch. Now I'm going to ask you to just sit for me here. Okay, and I'm going to ask you to just cross your arms and then turn towards your left side. Do you have any pain there?
No.
Okay, so you have about 20 degrees of left side rotation in the lumbar spine. That's normal. I'm just going to apply a little bit of overpressure. Do you have any pain?
Nope.
Okay, that's tissue stretch, and then again on the other side. Okay, do you have any pain there?
Nope.
Okay, so I'm just going to apply a little bit of overpressure. Pain?
Nope.
Okay, so that would be a tissue stretch and feel, and again, she has about 20 degrees of L spine rotation on the right side as well. So that would be your active and passive. Now we're going to do resisted. So resisted is going to be testing for your muscle strength.
Okay.
Okay, so I'm going to have you do the same motions and just resist the force that I give you. So right now we're going to test resisted range of motion of your L-spine flexion. So I'm just going to place my arm across you like this, and I want you to meet my pressure and try and flex your lumbar spine. Okay? Pain?
No.
Okay. I'm going to do it again in the back. Try and extend. Pain?
No.
Okay. And then I'm going to have you lean to your left side. Pain?
Nope.
Okay. Okay, and this side. Any pain?
Nope.
Okay, and then I'll have you again cross your arms like Genie. And then push in your elbow into my hand. Any pain?
No.
Okay, and then on this side. Pain?
Nope.
Okay. All of those were grade 5 muscle strength. So now we're going to do some special tests. So we're going to start with the straight leg raise. So I'm going to ask my client to lay on her back. And this is going to check for tension on the sciatic nerve as well as herniated disc that may be causing some pain in the lumbar spine. So what I'm going to ask my client to do is just lie there while I passively raise their leg. Okay, and we're looking for pain between 30 and 70 degrees of hip flexion, and that's going to indicate a possible herniated disc that we would refer out for. So as I lift your leg, let me know if you feel any pain, okay? Feel any pain?
No.
Okay. Good to keep going?
Yeah.
Okay. Any pain? No. Okay, so past 70 degrees, there's no pain there, so that would be a negative for the straight leg raise on the left side. Now we're going to test it on the right side, because you always test bilaterally. So I'm going to do the same thing. Again, let me know if you feel any pain as I raise your leg. Any pain?
No.
Any pain? No. Okay, so you're past that 70 degrees. There's no pain, so that would also be a negative for straight leg raise on the right side. And that's going to indicate that there's no possible herniated disc that we can tell at this time. Now we're going to do a sacral gap and shear test, and it's going to test for SI joint dysfunction, and that can cause anterior posterior pain, which can radiate into the lumbar spine. So what I'm going to do is I'm just going to apply pressure on the sides of your hips here, and then let me know if you feel any pain in the front or the back. Okay? Okay.
No.
Anything?
No.
Okay, and now I'm just going to do the the shear. So I'm just going to place my hands here, and I'm going to try and pull your hips apart, okay? Let me know if you feel any pain in front or the back. Pain?
Nope.
Okay. So that would also be a negative test for SI joint dysfunction that would radiate pain into the L spine. So from here, we're going to move into neuro testing. So I'm going to ask my client to have a seat with your legs hanging off the front of the table. Again, have you just face me a little bit. Okay. So what we're going to do first is we're going to do dermatome testing, and this is just going to test for any changes in sensation on the skin of your legs. We're going to test the front, the back, and the outside and inside of your legs. But anytime you feel uncomfortable, let me know and we can stop. Okay? So if you feel any patchiness, any loss of sensation, any different sensations, let me know. Right? Okay? Anything? Okay. Anything different? No? Anything different? Different here? Okay, so that would be a normal dermatome. So now we're going to move on to our myotome. So we're going to do hip flexion, which is L2 as our myotome. So what I'm going to do is I'm just going to ask you to, again, resist the pressure that I apply down onto your knee. Try and flex your hips as much as you can. This is going to test for fatigable weakness to make sure that that nerve can conduct that signal to the muscle for at least 5 seconds. Okay? All right. So just meet my resistance. Try and flex your hip. 1, 2, 3, 4, 5. Okay, so that's good. I'm just going to test the other side as well. Again, for 5 seconds, try and flex your hip. 1, 2, 3, 4, 5. Okay, so that's good. And the last part of the neuroscan that we're going to do is reflex. We're going to do the reflex for L3, and that's going to do knee extension. So I'm just going to do a patellar tap on the patellar tendon. So I'm just going to take my hand like this. I'm going to do like a karate chop along your knee. Your foot's going to swing out a little bit. If you feel uncomfortable, any numbness, tingling, let me know. Okay? Okay, and that would be a grade 2 reflex. That's normal. So, based on our findings from our assessment, the range of motion is all normal ranges. All the passive tissue stretches are there, or all the passive hand feels are tissue stretch, which is normal. She has great muscle strength in her lumbar spine. Special tests both came up negative for straight leg raise. Stop! For straight leg raise. And for sacral gap and shear test. So that indicates that there's nothing going on at the SI joint that we should be concerned about. There's no disc herniation that we should be worried about either. So, what I would do for a treatment plan is I would work the surrounding structure, so the low back, the glutes, into the legs, the quads, the hamstrings, and just kind of treat the structures around it and do some further testing to determine what's going on in her lumbar spine.
The end.
We were so